Hello and welcome to another edition of Tuesdays with a Disability Policy for All. This month is Autism Awareness Month, and today I had the great fortune to be talking to one of my colleagues and a friend of mine, Shannon Haworth, who is the Public Health Manager here at AUCD, and for the purpose of this interview, I'll be talking to her about her role as a public member of the IACC committee, because she's a parent of a child with autism. So welcome, Shannon.
Thank you, Liz.
The first question is, what does IACC stand for, and what is the purpose of the committee?
Sure. So the IACC stands for the Interagency Autism Coordinating Committee. It was originally established under the Children's Health Act of 2000. It was reauthorized in 2006 under the Combating Autism Act of 2006. Again, it was reauthorized in 2011, and this last time it was reauthorized under the Autism Cares Act, which is the Collaboration, Accountability, Research, Education, and Support Act of 2014. We are appointed by the Secretary of Health and Human Services. There are federal members, public members, and there are also alternates for people who can't be there sometimes. We meet quarterly, and my term is 4 years, so I'm a public member. So I represent AUCD, but I'm also the parent of a child with a disability, so when I'm there, my hat is there as a family member. That's who I represent. Their purpose is to provide the Secretary of Health and Human Services with recommendations regarding federal activities and research about autism spectrum disorder, and also increase public understanding.
Okay, thank you. What are the purpose of the reports?
So there's 2 reports that we're required to submit under the Autism Cares Act. The first one is the Strategic Plan for Autism Spectrum Disorder Research. And that one provides the Secretary of Health and Human Services and other agencies with recommendations to guide autism spectrum disorder research efforts. And the second one is a summary of advances in autism spectrum disorder research. And that one helps Congress and federal agencies and also other stakeholders and the public understand whatever significant advances there have been in autism research in the past year. So we are working on 2 reports. We didn't publish one in 2014 or 2015, so that's what we're working on now. We're in subcommittees.
Okay, great. Thank you.
Mm-hmm.
What did I'm on the President Committee on People with Intellectual Disability, and what is the difference between this committee and that committee?
That's a great question. Well, the IACC provides information and advice to the Secretary of Health and Human Services about autism spectrum disorder, and it's regarding federal activities related to autism spectrum disorder. But your committee, the President's Committee for People with Intellectual Disabilities, their mission is different. They provide advice and assistance to the President of the United States and the Secretary of Health on topics that impact people with intellectual disabilities.
Okay, great. Thanks. Is there anything else that I missed or that you would like to talk about, Liza?
Yes, I would. I really would like families and self-advocates and members of the public to know that we really want your comments and input on these meetings. These meetings are public meetings, and you can involve yourself in 4 ways. If you can't be there in person, you can send in written comments, and we get them before the meeting and we read them. The last meeting I summarized them, and I really try my best to reflect the spirit and the comments and respect people's views when they send in those comments, and we take turns summarizing them each meeting. You can also call in and listen, or you can, if you come in person, you can come and give your comments yourself, and we get your comments before you get there and you have 3 minutes to present them, or you can just come and sit in the audience. The next meeting is April 19th, and it's at the National Institutes of Health in Bethesda, Maryland. And if you want more information about the meetings, there's telecasts, you can listen in, or you can go in person. You can go to iacc.hhs.gov.
Okay, thank you. And if you have any more questions about this or any other issues, any other policy issues, please go to the AUCD webpage and look for this week's in brief. And if you have any questions or comments about this week's Tuesdays with Liz, please leave them in the space below. Thank you and have a nice day. Bye. Bye. Thanks again, Shannon.
Of course, my pleasure. Thank you.